Head into the papers now, see what the headlines are in Nigerian newspapers. Joining me now via Skype from Enugu is public affairs analyst Ambrose Igboke. Also joining me from Skype from Ogun State is journalist, media consultant Ifedayo Akimbode. Gentlemen, nice to see you both on the program this morning. I hope all of you are safe where you are.
Yeah, good morning.
Good morning.
Good morning.
Good to see you, Mike.
Good to see you too. All right, let's start from News Direct. News Direct says COVID-19. Federal government lifts interstate travel ban, reopens schools, plans to lock down 20 high-risk local government areas. And the NURTW commends federal government and ASU cakes. All right, this is what you see on the front page of the News Direct. From there, let's go to Daily Trust newspaper. Daily Trust is talking about COVID-19 and its fallout. Federal government lifts interstate travel ban and reopens schools for graduating students and approves safe resumption of flights. A free movement, good for us, transporters say. Okay. And then from there, Blueprint is next. Blueprint newspaper. Federal government extends eased lockdown by 4 weeks. Lifts the ban on interstate travels. NURTW, Lord's move. And primary 6, JSS 3, and SS 3 resume for exams. And parents ASU differ on school reopening. Hope rises for flight operations. Okay, that's the Blueprint newspaper. Daily Times is next. And it says, at last, federal government lifts the ban on interstate movements and approves safe reopening of schools. Says primary schools, daycare centers to remain closed. OK's resumption of domestic flights and moves to lock down 18 local government areas with highest number of COVID-19 cases. Okay. From the Daily Times, let's go to the national economy now. Boost for domestic gas utilization as PMB flags off $2.8 billion pipeline project. Okay, that's the national economy. The last one now is the Leadership newspaper, and it says respite for transporters as federal government lifts interstate ban, extends phase 2 of gradual easing of lockdown to July 27th. A reopen school for primary 6, JSS 3, SS3 students, and domestic airlines get note to reopen while Nigeria's COVID-19 mortality is low. The PTF is saying this, and Gilead pegs price of coronavirus drugs remdesivir at $390. Okay. This is quite the headlines today are talking about almost the same thing, fallout from the presidential PTF updates yesterday. Ambrose, let me start with you on this. The issue of the lifting of the interstate travel. It's a thing of concern now. A lot of people say it's a welcome idea, especially the NURTW. A lot of travelers. Some people traveled and they were trapped where they, in parts of the country where they are waiting to return to their bases. Now, what do you make of this, especially when the numbers are still increasing? Ambrose.
Well, I think the PTF has done the right thing. Is a step in the right direction. We cannot keep locking down forever. Rather, we should get proactive and to gauge the reality and see how we move forward as a people. The COVID-19 as a disease is here to stay with humanity, and Nigerians are part of human society. Therefore, you cannot lock down forever. What you have to do is see how you can mitigate the problem. Now, what has happened is we have locked down the borders for a while. Well, it has not been effective because people travel around the country. That boils down to our own discipline. While the government is trying on its own side, the citizens themselves refuse to obey, and there are a lot of interstate traveling that have been going on clandestinely. Now, what has happened now is we are at the stage of community transmission, and that is where the COVID-19 situation is. And this time around, we should expect more COVID-19 cases. Now, from now on, I think the shift in terms of messaging, in terms of awareness, should be to the individual. How do we empower the individual with the correct information to be able to guide against contracting the disease? That should be the next stage. The stage of scaremongering or telling people to be afraid is over. What we have to tell people is the reality on ground and how they can prevent themselves from contracting COVID-19 And in any case, if they see the symptoms, what should they do? So all these things should be done. And then ramp up capacity for testing, increase more isolation center, empower existing hospitals and clinics to be able to treat them, bring out more PPEs for healthcare workers, and then look into the homegrown solution of how drugs can be used and manufactured in Nigeria to be able to treat symptoms of COVID-19.
All right. Now, Akimbode, let me bring you in here. Now, the point there is the talk about the likelihood of locking down about 18 or 20, depending on the figures, local government areas across the country. And some analysts from yesterday are saying, why not just lock the entire state down instead of certain local governments, since there is a fluid movement within the states between one local government and the other. What do you make of this?
Well, thank you very much, Mike. I think essentially we have not done very well in the area of messaging and advocacy. Essentially, the COVID-19 pandemic, like Ambrose said, is here to stay with humanity. And beyond the scaremongering, what we should do is to ensure that we provide adequate information, especially to the people at the grassroots. You will be surprised that when you go to the market, especially in Ogun State, people mingle freely. You don't see people cover their faces. And then you keep wondering whether these people live in Nigeria and they actually believe that this COVID-19 is real. But unfortunately, we have limited advocacy, essentially for the elite. What about the people at the grassroots? What information are we giving them? Well, especially in Lagos, I think about 10 local governments, they are proposing to lock down. I should think that it is not necessarily needed at this point in time. What we need to do is to ensure that we encourage the citizenry to take responsibility. Whether you lock down or not, people will devise means of moving around. For example, they just lifted interstate travel. Everybody knows that people travel from one state to another in Nigeria. And the security officers are complicit in all of this. Because, Nigerians, they will pay their way to get to wherever they are going to. So there is no need to do complete lockdown. What we need to do is to increase our capacity for testing. Increase our hospitals, provide PPEs, continue to test, and continue to treat. There's no basis for lockdown because it's not going to work. It's never going to work.
Okay, no basis for lockdown. All right, Ambrose, let me come to you on this. At the start of the pandemic, you remember health experts were saying that there is no need to panic, there is no need to fear, there's no need to be scared about anything. And because the fatality rate at that time was below 3%, so everyone went to sleep. Is that what is responsible for this non-challenge now? When you talk about the issue of social distancing, you're talking about the issue of constant hand washing and also use of face masks. Everyone is nonchalant about it. Has everybody come to terms with the fact that, well, if you contract you contract COVID-19, you mustn't die, so there's no big deal? Is that what is coming back to haunt everyone now?
Well, I don't think the problem has been that we have issues right from time. The healthcare providers have not in any way, said, everybody was confused. They didn't know what it was. That is the truth. And because they didn't know what it was, there were conflicting messages all over, and people were confused at the time. But when we got to understand the nature of the virus, messaging became clearer. For example, in the use of masks, the World Health Organization did tell us initially that masks were meant for healthcare providers who are in the front line, who are attending to COVID patients, and also for people who are showing symptoms of COVID so that they don't transmit it to others. And then they mentioned that it is only the N95 kind of face mask that can prevent transmission. But what do we have today? We have all sorts of materials, all sorts of things being used as masks. Can that really prevent COVID-19 from spreading? Those are the questions we should ask ourselves. And then, when the nature of the dynamism of the virus was being understood, remember that the World Health Organization told us that it was not airborne in the first instance. So there was a lot of conflicting. So we don't blame the healthcare practitioners for saying what they said. But now, the reality on ground now is that the COVID-19 is here. It is airborne. It can be transmitted. But all the social distancing protocol is not existent in Nigeria. It is not, as my colleague has said, it's not existent. Go to the markets, go to places, it's not existent. Okay. So what do we do? The practical thing is now to say, how do you prevent it more? It's not only by not wearing masks and the rest. What are the remedies? We heard of the work of vitamin C. We heard of boosting the immune system so that the immune system can naturally fight it in some people. We even hear of some drugs that are already available. Now, my problem with Nigeria, and I keep on reiterating this, is that we have refused to even look inwards to find lasting solution to manage the symptoms of COVID-19.
Right.
If we had done that like Madagascar did and some other countries have done, we'll not be where we are now. So the next option is ensure that we face this thing headlong and not to lock down people and lock up people.
Okay, thank you, Ambrose. Let me come to you before I let you go. Now, the point there is, if you even get to the cities like Lagos and Abuja, Kano, Port Harcourt, there are people who have perfect knowledge of what COVID-19 is, the dangers, the dynamics around it, and all of that, but still find it difficult to abide by all the protocols. Now, at this point where the numbers are increasing, what would you suggest is done at this time? Some people have recommended the use of police and security agencies to ensure to ensure compliance from the people. What do you say?
Mike, my position is that personal safety is personal responsibility. Nobody is going to force everybody not to die. If you choose to die and you want to die through the pandemic, I wish you well. If you choose to live and choose to be responsible, I wish you well. Even the security officers that we are talking about, how many of them are also complying with the directive of the federal government? No, if you go through the checkpoint, most of them are not even wearing the face mask. Some of them will try to peep into your car without protecting themselves. So you are going to be left with no choice than to roll up your car. So the issue is not about forcing the security officers to ensure compliance. It's about advocacy and telling people what to do, which is right. The government cannot force anybody to be disciplined. I think that Nigerians are a set of indisciplined people, and that is the challenge that we have.
All right.
And what we need, like I said constantly, is to continue to put up genuine advocacy and the reality of this pandemic to the people. Maybe Nigerians will believe that it is real.
Okay. Now let's hit the news now, starting from News Direct. News Direct is what we have here. COVID-19. Federal government lifts interstate travel ban, reopen schools, and plans to lock down 20 high-risk local government areas. And NURTW commends federal government and ASU kicks. Okay, we'll be talking about the resumption of schools for JSS3, SS3 as we get along shortly. From there, let's go to Daily Trust. Daily Trust newspaper. COVID-19, federal government lifts interstate travel ban, reopens schools for graduating students, and approves safe resumption of flights and free movement. Good for us. Transporters say this. Okay. From there, let's go to the Blueprint newspaper. Federal government extends eased lockdown by 4 weeks, lifts the ban on interstate travels. NURTW lauds the move. In primary 6, JSS3, SS3 resume for exams. And parents ASU differ on school reopening. Okay, from there, let's go to Daily Times now. At last, federal government lifts ban on interstate movement. That is what the Daily Times is saying. Approves safe reopening of schools. And a lot of Nigerians are debating on the reopening of schools. A national economy is next right now. And it says boost for domestic gas utilization as PMB flags off $2.8 billion pipeline project. Okay, from there, let's go to the Leadership newspaper, which is the last one now. Respite for transporters as federal government lifts interstate ban, extends phase 2 of gradual easing of lockdown to July 27, reopens schools for primary 6, the JSS3, SS3 students. Okay. Gentlemen, Ambrose and Ife, let me come to you on the... Ife, let me start with you first. The call to open schools for graduating students, primary 6, JSS3, and SS3 for them to take exams. That has not gone down well with some stakeholders. Teachers are saying they don't want schools to open yet because a lot of things that need to be put in place are not in place yet. What do you make of this? Ife, let me start with you.
Thank you, Mike. Let me first correct that my name is Ifekayode.
Ifekayode, yeah.
And not Ifedayo. Thank you. Having said that, well, average Nigerians should be worried, especially parents, about how their wards will be taken care of when they resume. I'm not sure that the PTF, that is the Presidential Task Force on COVID-19, has clearly defined the modus operandi of how these things will pan out, how the students will be taken care of. So naturally, every stakeholder should be worried. If I have a child who is going to resume, I should have to go to the school and check the environment and the cautions and the precautionary measures that are to be taken to ensure that they are safe. So beyond resumption, beyond the rush to open school and to do examinations, what are the factors? What are the things put in place to ensure that these children do not contract this COVID-19? It's essential because these are young people and they're also very vulnerable. And especially in an environment where we don't have very good hospitals. So if they come down and they are, these young people will easily mingle. There are not going to be any social distancing. There is nothing anybody can do about it. So those who are worried, the stakeholders who are worried, have genuine reasons to be worried. As parents, we should be worried. What are the modalities put in place before the schools are reopened? If those questions are answered, then we can consider the issue of reopening.
All right. Now, Ambrose, let me come to you on this. Now, water is very vital when you talk about hygiene. Anyhow you put it, water is really essential. In many or most of the public schools, we don't have running water or adequate water from what we see sometimes. Now, how challenging would this be when the government is telling schools to put all the necessary measures of all the measures in place before resumption? What do you make of all of that?
Well, when I first heard about the World Health Organization social protocol on the COVID-19, that people should wash their hands on running water, I made a joke that Nigerians don't even have water, talk less of it running. Where is this running from? Our taps are dry. So there's no running water in Nigeria. Majority of Nigeria, most Nigerians don't have running water. Well, Nigerians wash inside basins and pans and all those things, which is not good for COVID. So basically, most of our, as you correctly observed, most of our public schools don't have tap water. They don't even have potable water, talk less of running water. So the issue of running water is out of it. And we remember the cases of some high-level public schools, like Queen's College, what happened last time, cholera, and some other things that happened in some of our unity schools. Now, another concern I want to raise beyond the water issue is the issue of some of these schools are boarding schools, and some of the students live far away in many other states. For example, think of the unity schools around. People come from all parts of the country to unity schools. How do you expect parents to now move these children from their various states? I think there's no hurry in opening the schools. Since schools are not going to, you are talking about the SS3, which universities are going to absorb them anyway. The universities are not in school. So the universities also will have to extend their semesters and sessions some way. So I don't see the hurry, and I think that they should tarry a little in opening the schools to put all things in place, because the way the things are, the economy has not, have not picked up, things have not resumed normally, and asking the children to go back is not the best for now.
All right. The parents are really concerned about the issue, the idea of resuming schools. But you speak to some parents and they say the children have been home for a long time. But let's talk about the issue of online learning and the engagement of students even at this time when students are at home. How effective a tool would that be, engaging students online or even on air with TV and radio?
Well, Mike, we all know the Nigerian factor will have to play in all of this as we're talking about. How many homes can afford, stable power supply in Nigeria? How many parents could afford to get smartphones for their children? So essentially, these things may not necessarily work. It can work with the elite. It may not work with those who are in the rural environment. Well, Ogun State government has done fairly well here in Ogun State through what they call the digital class. They do it on radio, they do it on television. And from the feedback we have gotten so far, Ogun State government is actually doing very well in that area. But that is not to say people in the rural area have access to all of these things that we're talking about. But speaking about the Nigerian nation, I'm not sure that even the federal government is looking at any other ways of engaging the students while they are home because of the pandemic. And I'm not too sure that parents should take responsibility. That I would say, at our own level, parents should have a way of engaging their children and educating them while they are home till this thing is all over.
Okay. Now, Ambrose, now some states are impacted more than others from COVID-19. And a few persons we've spoken to have said that the government can begin to ease or reopen schools from state to state in phases. What do you make of that? From states that have less cases of COVID-19 can consider resuming and then gradually before it gets to the states that are worse hit, like Lagos and the FCT.
Well, right from time, the presidential task force just gives direction. They don't actually implement the directive in terms of, making it work in each state. And they have always given the states some priority to manage the situation in their various states. So it's not a blanket statement. When the PTF has said it, it's just, okay, we have lifted up this ban on such things that we placed a ban on before, like the schools. So it is left on the states. It's left for the states, it's left for the local government, and also the private owners of schools to see if they want to open their schools. But again, that goes to show it's also at the level of the West African Examination Council, the NECO, National Examination Council of Nigeria, and other examining bodies to say either they are ready to say this. So this still is not a statement that happens with a magical one. The PTF, I just said, they have released the the lockdown, and they also ask schools they can resume. But it doesn't mean that all states will resume or that the examination bodies will be ready to conduct. So as we say, it depends on the states. So if the states feel that they are not ready because of the increased level of the numbers of COVID-19 infections, then they can say we are not ready to open the schools, and then talk with the examination bodies and know when to conduct their own exam. Or I think by this time, the different states should start engaging the examination body at that level to see if these people are ready or not. And then it is the stakeholders that will now communicate back to the examination bodies to say we are ready or we are not ready. I think there's a structure. The NUT is there, the Proprietary School Association is there, the government agencies are there. So there are enough structural organizations to ensure that they can communicate with examination bodies and see when it is the right time, since the federal government have removed the lockdown.
All right. Let me come to you before we leave now. If we go to China, where students have resumed and school is picking up as normal, we see that from the reports we're getting that government has officials monitoring the implementation of the protocols in every single school, and every school complies with that. Now, if we bring it back home here, some people have called for government to engage with schools as a way of helping to give a guide to how these things should go and how they should be implemented, and government getting really involved with the process. What do you say?
I think we're always getting it wrong in Nigeria. We can't compare the protocols observed in Ghana and China with Nigeria. Just like Ambrose said, we do not have running water in Nigeria. So the modalities used in China to cope COVID-19 might not work. What we need to do is to clearly define homegrown solution to solve this problem before we take decisions. I think PTF should look inward and look at what are the peculiar nature of Nigerian nation. What are the challenges that we have? Then we now devise means to ensure that those things that we are going to do will be in tandem with the reality on ground. China is a country that is advanced in technology. China is a country that is advanced in virtually infrastructure, in everything. So they can afford to define most means and monitor it and ensure compliance. But it can't work in Nigeria. It can't work in Nigeria. So we should not use China model to solve Nigeria's problem. We should rather look at homegrown solution to solve Nigerian problem if you do not want to get into a serious crisis with this pandemic.
Okay. Ifekade Akimbode, thank you so much for your time on the program. Ambrose Igboke, thank you so much as well for joining us on the paper review. Thank you, gentlemen.